Professor Goncalves, do you want to start us off?
Sure, absolutely. Thank you. Thank you, everybody, for joining. On behalf, we just finished an interview, so I don't know if my two colleagues are on yet. So on behalf of Dr. Watson, Professor Duville, and myself, your faculty, we would like to welcome everybody to the 2020 Virtual Career Fair. This is a little different this year than we've done in past, but hey, what the heck, year 2020 has been not like any other year as well. We are living through a COVID pandemic, and I think it is great that we have been innovative, and our community partners, our organizations, have agreed to do this virtually. The show must go on. And in healthcare and in nursing, we know that the show must go on. We just have to pivot. We have to adjust. Our students, thank you to all of you. You exhibit resiliency and commitment, just like our healthcare partners. In 8 short months, you're going to be graduating and taking the NCLEX and applying for your first professional jobs. And we are truly blessed. We are truly blessed for our organizations who are here with us today, giving up their time because they are going to be looking to hire you. This is truly a blessing, though, because this is one-to-one attention that they are giving us SHU students. If you go to a career fair, even the virtual ones, you're vying with all the other organizations, all the other institutions, all the other universities. So this is a special time that they have dedicated their time to give to us and to give to you. So I want to thank you all for doing that. And I do want to pause and thank Miss Marianne, Cicely, Helen, and thank you, Carolyn, for doing Handshake. Handshake is Greek to me. So we're going to see how it goes today. And I just want to thank everybody for being here today. I truly appreciate it.
Thank you so much for that. And so without further ado, I'm going to introduce our 3 panelists. Students, please do not hesitate to start asking questions as soon as something pops into your head. Just put it in the chat box and we'll be sure to answer as many as we possibly can. The majority of the session is going to be Q&A, so keep that in mind. But for my panelists, just introduce yourself and tell us a little bit about your organization, and definitely use that time to sort of preach about your offerings. So we have Caroline Rodriguez, who is a recruiter for NYU Langone. Thank you, Caroline, that helps. We have Ann LaCamera, the senior talent acquisition partner for Yale New Haven Health, and Tyler Stevens, recruiter at Hartford Healthcare. And so if you put it on speaker view for students, you'll be able to view them more easily, but it's completely up to you. So Caroline, why don't you start us off?
Hi, everybody. I am a recruiter here at NYU Winthrop Hospital through NYU Langone Health. My focus is on the Mineola campus, and right now with COVID, we have had a whirlwind of adventures. We weren't hiring for some time, but we actually just started opening up our fellowships, our critical care fellowship, our ED fellowship, and we're hoping to have it next year as well. So those typically open in February, March, so you have to start early. I think that was one of the questions that Patty sent over. And I've been at NYU for 3 years now, and I'm really excited to kind of get to connect with all of you. Short and sweet.
Thank you for that so much. Ann, do you want to go next?
Sure. My name is Ann LaCamera, and I, as Patty said, Senior Talent Acquisition Partner at Yale New Haven Health. And I'm actually representing all 5 hospitals in the system: Greenwich, Bridgeport, Yale New Haven, Lawrence and Memorial, and Westerly hospitals. 4 of the 5 hospitals traditionally do hire new grads. The one that does not as frequently is Westerly, which is in Rhode Island. All of us do hire new grads into quite a few areas. Greenwich, it's mostly med-surg. Sometimes it is in obstetrics. And at Bridgeport, they will hire into medical and surgical units, including the subspecialties. They also do an ICU and many times an ED internship, obstetrics, psychiatry. Lawrence and Memorial is also hiring predominantly in med-surg for new grads. And Yale New Haven, we hire new grads pretty much everywhere except for ambulatory and the PACUs. So medicine, surgery, the subspecialties, pediatrics, obstetrics, psychiatry, ICU, ED. And just to sort of do a couple of questions that we had gotten ahead of time, pretty much all of us have some sort of applicant tracking system where you do submit your information. And our interviews predominantly tend to be behaviorally based. So we will ask you about a time that you were working as part of a team. We may ask you about a complex patient you've cared for. And I would say pretty much the same thing, probably starting to look in February, March for positions that would be available in the summer of next year. If you start to look now, you can get a sense of what is typically out there, but if you apply this early, managers want to fill these positions now. They don't want to wait 8-9 months. So you can certainly look, get a sense of the organizations, all the organizations you're interested in. But I would say to wait until February, March to seriously look and start applying then.
Thank you so much, Anne. All right, Tyler. Can't find you. There you are.
I'm here. Good morning, everybody. So Tyler Stevens, I am with Talent Acquisition as a recruiter for Hartford Healthcare. We have about 7 acute care hospitals, almost 400 brick and mortar locations across Connecticut. And we've been quite busy this year. We actually just recently wrapped up our fiscal year on 10/1, found out that we hired a total of, I think, just under 9,000 employees for the year of 2019. Of that, about 5,000 external employees. So we've been incredibly busy. We're hiring quite a bit as well. Some of the predominant needs right now are focusing at Hartford Hospital as well as St. Vincent's Medical Center, which was a recent acquisition that happened late 2019. So plenty of opportunities here. As far as, to address what Ann said, as far as getting started here with the new grad programs and residency, when it comes to more specifically for you December grads, now's a good time to start looking. Usually advise about 2 months in advance for all the May grads. Again, usually about 2, maybe even 3 months in advance come March, April. It's always good to kickstart that process, but I don't want to dig too deep into this now. We'll let the panel start, but that's it for us.
Thank you very much. I appreciate that. So I'm going to start asking some questions, but students feel free to interject using the chat box. And if you prefer to speak your question out loud, please feel free to just mention that in the chat box and be happy to unmute. Okay. So we talked a little bit about the timeline as to when students should start focusing on getting serious about submitting their applications. But I want to dive a little bit deeper into nurse residency programs. What exactly does that entail? How is it different from traditional positions? And when should students start paying attention to nurse residency programs versus maybe a traditional entry-level position?
Yeah. Hi, this is Ann. I'll start. One of the things I think students need to be aware of is what is the definition of a residency program at the particular organizations. Some call their orientation a residency, and that's perfectly fine. But then there are other specific residency programs which are not the orientation and kind of dovetail on. That's what happens at Yale New Haven Health. And the residency program is to provide more support over your first year as a new grad to help with that transition. And you're automatically part of it if you're hired into a position of 24 hours a week or more, so you don't apply separately. And every month you're cohorted by your start date, so you can be with people in the same unit, in the same service line, and other service lines. And every month there's a 4-hour session that is scheduled. And it can be with topics such as using evidence-based practice in your practice, honing critical thinking skills, culturally competent care. They always include tales from the bedside so people can share what they're experiencing. And at the end of the year, each resident does a project. It could be a quality, a safety, a metrics project. And again, this is to provide more support over your first year. It is not your orientation. that is separate. However, they do intersperse and dovetail together. But again, just to make sure that any student understands what that, what that organization's definition of a residency is, so that you know what you're going to be getting.
Right.
Great point. Yeah.
I
Oh, do
agree.
you mind if I jump in here as well, Ann? Just kind of piggybacking off of that?
Go ahead.
So similar to Ann's, Hartford Healthcare, we actually don't have consistency across the network specifically for residency programs, but using Hartford Hospital as an example. So being hired into the residency program, you'd get hired directly to the hospital. You'd go to your general hospital orientations and then nursing trainings and orientations on top of that. But from there, you're actually auto-enrolled into a first-year residency program. And again, very similar to Yale's network. They meet on a monthly basis. Everyone who would start in through the, for example, August residency program, our staff education team would bring them in for monthly seminars, and you wouldn't actually be siloed to your specific department. You're actually going to be collaborating with other folks across different departments within that hospital as well. So meeting on a monthly basis, and then you're going to be addressing topics in these monthly seminars, situations that you've learned in nursing school that you can continue to grow in. So for example, readdressing situations such as paying attention to signs of domestic abuse, right, and exploring the resources that we can share, phone numbers, best practices, and just diving a little bit deeper into those topics.
Right, and NYU is very similar in the same. We auto-enroll you in the residency program. It's a requirement for all new grad nurses to enroll, and similar to Yale, you have it's cohorts. So you're starting with new grads from all different specialties. We hire new grads into labor and delivery, med surge, OB. We hire into tele, ICU. So you're starting with all these new grads in different specialties to really start networking and really get a solid foundation. We also do an evidence-based project at the end as well that you have to present. And we only hire new grads into full-time positions for us. So that's a little bit different.
So I'm going to transition to a harder question. So what are the most sought after skills when reviewing entry-level applications? And I know that's really hard to pinpoint.
So I can chat upon that a little bit. I think interpersonal skills is huge because as a new nurse, you're still learning the craft, and that's understandable. But something that we really focus on is patient care and how you interact with patients. So I would say that's number one. And a part of that coincides is your networking abilities. I get so many new grads. I usually take the referrals. So that really tells me that you've built a solid foundation, that you've built relationships, that you're networking, and that's huge in nursing. So networking is key.
Agreed, Caroline. Interpersonal skills are incredibly important in these situations. Everybody, is graduating, taking the NCLEX, becoming an RN, but at the same time, what's going to set you apart is essentially how you're carrying yourself, right? Customer service at the end of the day, right, as a registered nurse. You're dealing with folks on a day-to-day basis who are predominantly stressed. How you can handle and navigate those situations certainly stands out. And that kind of branching off of that, and I might be diving a little bit too far ahead, but for the folks coming out of 2021, right? It's a ways out, but beginning to build relationships with preceptors and folks that you're interacting with on a day-to-day basis on clinical rotations. I mean, I can't even begin to emphasize how important that is. I mean, a lot of these folks that are working with you on a day-to-day basis have connections elsewhere. It may not just be your hospital. So making sure that you're interacting and doing everything that you can to expand on your network is incredibly important. So great point, Karen.
Yeah. And as far as skills, we can teach you the skills. We can teach you how to do things. It really is those core values, core abilities to communicate, and those interactions with patients and with your coworkers, because it is teamwork too. I mean, that's something that's very important, and you probably have seen that in your clinical rotations.
Thank you so much for that. And I want to sort of stay on the topic of how you identify the ways in which these students have those skills. So I want to talk about the interview. Anne was kind enough to start to mention about the types of questions you may be asked as it pertains to clinicals, but I'm going to even open it wider. If you can divulge anything about the interview process that could help these students prepare when they are ready to interview, that would be great. But I know specifics might be, you know, you might have to leave those out. I get that.
Yeah.
So,
Go ahead, sorry.
well, I was going to say that the interview process starts as soon as you walk in the door. I have gotten candidates who come in and were rude to the front desk person. It's sad, but it's literally, it's as soon as you walk in. And it's hard to not be biased when you're treating the front desk person rudely, right? So I think that's a big thing. It's all interactions. You could be sitting at the front desk and our CNO walks out. You don't know who the CNO is. You may not recognize the CNO. So it's really always having a smile on your face and being polite. And if you're lost, you know, asking someone and not wandering with a rude face on. So, I mean, I think that's big. You'd be surprised how many people my front desk person calls me like, this person was so mean to me.
Agreed, especially, oh, go ahead, Ann. I'm sorry.
I was just going to say, oh yes, and standing at the door gesticulating, saying, oh no, even just talking, how people communicate on the phone. I want to talk about taking it a step back, just even earlier than that. When you apply, what your information says about you when you submit it. One of the questions that we had given ahead of time was, what were some of the most common mistakes new grads make? I think one of them, which is not a horrible one, but many do in healthcare, is on their resume, they don't put non-healthcare related experience. I want to know if you've worked anyplace else other than maybe working as a nurse aide or a PCT, or you volunteered. Yesterday, I interviewed a dosimetrist and the information was all healthcare related. And I said, have you done anything else? He used to deliver Chinese food for a restaurant. He had flipped burgers at a fast food place. Those are things that tell me other kind of work experience, which then how do you translate that into your nursing practice, the skills and knowledge you learned in those. I think another thing people tend to do is to not have complete and accurate information, and not paying attention to detail. We used to have a manager who you would show them an application and in 2 seconds she would give it back saying, no, I'm not interested. It's like, you haven't even looked at this that closely. They didn't fill it out completely. That tells me that their documentation is not going to be very good either, which is so important. Even something as simple as when you're submitting a cover letter, making sure that it doesn't say, I'm interested in applying to your position at Hartford Hospital or at NYU, when you're sending it to Yale New Haven Health, and vice versa, which also happens all the time. So some of it is being very careful about that. Then you also, how you're treating people when someone calls you. When you come in, if you're lucky enough to come in, we are actually not having people come for on-site interviews, which we've gotten pretty good at Zoom and some of the other FaceTime things. The one thing that we're not able to do yet because of our visitation policy is have people come in to do shadow experiences where they would normally be paired with a nurse and follow them around for an hour or two as they went through their routine. It is something that we do miss, but because of the nature of our situation now, we're not allowing it. So making sure people have questions, that a list of questions, and it's okay to have a list and to look at that list while you're talking with people to make sure you get the information you need.
That's great.
Absolutely, Ann. Those are great points. And, you know, what you had mentioned before, I think is incredibly important. Oh, I'm sorry, Caroline. Yeah, we're also not doing on-site interviews. We're also not allowing any shadowing at this point in time. It can get tricky, but again, there are other factors that come into play. And as you had mentioned too, it starts before the interview, right? Making sure that if there are specific questions within our applicant tracking system that are required, filling out everything, paying attention to details, making sure that you're populating the necessary areas. Is something as simple as even just titling of your resume, right? And it's something that's not just a whole bunch of numbers and letters compiled into one thing. And you'd be surprised, you know, we're not going to hold you accountable every time, but hiring managers will quite literally throw out your application right then and there if they see that you know, didn't take the time to title your resume first and last with resume. You know, it's something as simple as that. But again, little things like answering the phone, making sure that you're accessible, having a voicemail box set up. Okay, that's another thing that's incredibly important. A lot of times, you know, when reaching out to folks, you know, you may miss your job interview because your voicemail box was full or you didn't have it set up and we couldn't reach out to you. You know, we're going to reach out via email as well if that's the situation. But, you know, in certain times when we're looking at 40 to 50 applications, you know, if there's no way to connect with you via voicemail, we may send an email, we may not. You know, there's a lot of different applicants that may have their voicemail box set up. So I know that may sound kind of like a tough love situation, but it's important to pay attention to those fine details to ensure that you're best set up for that situation. And again, interacting with everybody. You know, I got a good relationship with the director of security at 2 different hospitals. You know, he has his folks pay attention. Who comes to the front desk to get a, you know, sticker, check in? How are they interacting? Are they starting any conversation? Little things like that. Is something that, you know, believe it or not, we actually do pay attention to. And it is incredibly important because, you know, you are being evaluated the second your resume pops up on our screen.
Thank you. And before we dive into that question that came through, Tyler, can you elaborate on applicant tracking systems for students who may not be familiar with what that ATS actually is?
Sure. So an applicant tracking system is something that we use to compile all of our resumes that's linked to multiple different job boards. So for example, we have one centralized system that we use to try to put this into layman's terms, I apologize, to send out a total of, you know, 30 different job postings to multiple different vendors, right? So we'll enter in a job posting. It'll blast out to 5 core vendors that we have who then send out the job descriptions to other, and I see Caroline sent that, and I'll send that as well, our career site. It's going to send out to multiple different third-party vendors that are going to post our jobs, right? Once you apply to a position under Hartford Healthcare, it's going to be directly funneled into our applicant tracking system. And within the applicant tracking system, we see your profile, your resume, where you're located within the state of Connecticut. It's going to show little things like years of experience. You can link certain certifications. And this is going to be your profile within Hartford Healthcare moving forward. So anytime you apply to any positions throughout multiple different hospitals, so for example, if you were to apply to a position at Hartford Hospital, but also apply to a position down at St. Vincent's Medical Center in Bridgeport, Connecticut, we're going to see the same profile for both positions, but consolidated into one centralized location to track, if that makes any sense. I apologize, I'm having trouble explaining that. Does anybody else want to jump in here?
So one thing that NYU does is in our applicant tracking system, since we do get a lot of new grad candidates, is there's two options. You get to copy and paste your resume in a resume section of our applicant tracking system, and you get to upload your resume. So just so you know, we use what's called a Boolean search, which is basically we type in keywords and it will pick it from your resume. But our system will only pick it if you copy and paste your resume. So always do both. Always upload it, a beautiful, nice resume that's all fancy, and then put your resume in the resume section, because when I'm searching through 300 new grads, I'm typing in, okay, this is a new grad position for the cardiac surgical ICU. I'm typing in who has cardiac surgical ICU in their clinicals. And if you're not in there, I'm not getting you. So just a little cheat sheet for you.
Caroline, real quick, I'm sorry. We used to do Boolean searches. So that was always fun to put together those algorithms, right? We recently transitioned out of there because Boolean searches are fantastic, especially if you can fine tune that. But, recently to make things a little bit easier, we actually implemented something called ACE questions, which is within our applicant tracking system. And what that is we're including the main qualifying questions within each application. So for example, looking at ICU, you need 2 years of experience. Are you an active registered nurse right now? Do you have an active license? Do you have 1 to 2 years of experience? On top of that, the last couple other questions, do you have experience in ICU or ED previously? So we'll have those as kind of like a drop-down menu to check off of. And that's going to be listed with your application. So we're going to see your name, phone number, location, along with hundreds of others. And then we're going to see requirements, 0 out of 3, 2 out of 3, 3 out of 3. And a lot of times, if we have a lot of applicants, we might just funnel directly to the 3 out of 3 right then and there, just to make sure that we're going to start with folks that are all 100% qualified for this position. They have 2 years of experience, and they have experience working in the ED or ICU. So again, that kind of goes back to attention to detail too, making sure that you're filling out every necessary location, even if it sounds like too much, even if there's a note section, add a little blurb, add a little something about yourself. I never want to say it's overboard unless you're a new grad and your resume is 3-4 pages long.
I'm going to ask a question that just came up on the chat box before we break. Elizabeth asked, what online resources or job boards should we be looking at to see job postings? I see in the chat box, just for everyone, if you want to open it up, the recruiters have indicated their specific job board. But if anyone wants to comment to additional ones, as you talked about it mushrooming out into the online job space.
Hi, yeah. For Yale New Haven Health, like NYU and Hartford Health, we use an electronic system, and all of us have a website, which is a chat box that you go to, and it's behind the scenes system, so you can look at positions, you can apply for positions, upload your resume, etc. Depending on the system and what the organization chooses to do, as Tyler said, they push it out to other websites, and probably NYU does too. We will do that on particular ones. A lot of sites will also, or job boards as many times they're called, will automatically, they call it scraping. So they will go in pretty much every night, look to see what is posted on our ynhh.org/careers website and pull those positions to their job board. They do that with Indeed, with LinkedIn, I think Career Builder. There are, depending on what you choose, there can be just a couple of sites or massive numbers of sites. Glassdoor is another one we do. One of the best ways to make sure you see everything is to go to that organization's website, and you can just Google the organization and find out what that website is and go there. You can also look at LinkedIn, you can look at Glassdoor, you can look at Indeed. There are certainly others to do that, but one of the best ways is to go to that organization's actual website, and it's so easy to do now, and then you get the direct information then.
Thank you for that. Okay, so this is a question that I often get, so selfishly I want to ask it. So would it reflect poorly if I applied for every available position that I qualify within your organization?
It is looked at, not necessarily negatively, but what it tells us is the first impression is you're desperate. You are going to apply for everything and anything without having taken some time to think about what you want to do, how you want to start your career, and go on from there. I mean, look, everybody's not going to get into the ICU, the ED, labor and delivery, or pediatrics, or cardiac, or transplant, or orthopedics. I mean, it's just not going to happen. So figuring out what areas you're more interested in and try to hone those, and concentrate on those first. I don't know what my counterparts think.
I think you're
Caroline,
right.
you want to jump in? Yeah.
Yeah, I think you're right. I think you should try to limit, like if you're gonna, if you want to be in like the hearts, right? Somewhere in the hearts, apply for telemetry, for cardiac, like apply for those worlds. And I know that you're interested in this, but in your interview, what I love, right, is when someone's like, but I'm willing, like I want to be in your healthcare system, but I'm willing to go anywhere. Right? So I think when you apply to everything, yes, you look a little all over the place. I agree with Anne, like you
Some
look
frequent
desperate. But when you're in your interview and you're face to face with that recruiter, you want to make an impression, right? So I don't only recruit I recruit for everywhere in the hospital. So if I like you and you've made a good impression, I'll be like, well, she did say she was interested in somewhere else. Let me redirect.
Exactly. And, we, as recruiters, our job is to build partnerships with senior leadership throughout the hospital, right? If you make a good impression, obviously, we actually have something in place right now at Hartford Hospital, or Hartford Healthcare, I'm sorry, called No Nurse Left Behind. And what that is a new initiative to share nurses throughout the system. You can't hire everybody. It's that simple. There's no real gray area. You just can't hire everybody, right? And we're taking it upon ourselves to make sure that, if you're a viable candidate, maybe, for example, the 36-hour FTE RN position, the cardiac step down, maybe that didn't work out, right? But, it's good to share this profile with, our sourcing team handles the No Nurse Left Behind initiative, where their core job on a day-to-day basis is make sure that we're sharing it with the other hiring managers who could potentially use you, right? So branching off of that, again, looking back at the applicant tracking system, it's centralized application. We're going to see when you apply to 180 different positions across the system. And, talent acquisition, we know who those names are. I can tell you off the top of my head, I know 4 or 5 people who I know have applied to 180 positions. I know the first, last, I know where they live. It's not a good look, more or less, right? So start in the target areas where you feel that, number one, you're a qualified candidate for. Number two, that it's somewhere you see yourself in the future. If that doesn't work out, again, looking back at building rapport and establishing your network, there's other opportunities come out of that. It's not just kind of, apply to 2 positions and be done. If you want to apply to, 3 or 4, that's fine. I wouldn't go crazy with 15 to 20. That might be a little overboard.
That was very helpful. Thank you for that. I appreciate it.
Can I ask one more question just for a clarification, maybe?
Yeah.
So as students I know you had talked about including some of their prior experience, whether it was something they did in a transition career or prior, you've worked in retail, you've worked in the food service industry, et cetera. Talk to us a little bit about the experience, if they are doing their clinical rotations, the things that they should really be indicating, whether it's those, what I like to refer to, those aha moments where it's not just an observation moment, or do you want to also see them doing CNA work, hands-on clinical, and how much of that do you want to see, and does it count towards the 1 to 2 years of experience?
Hi. Our positions, if it says that it's requiring a year of experience, it means RN experience. It doesn't mean that your clinical will count towards that. Having said that, though, I think one of the things that can be very helpful as we are reviewing applications and resumes, and managers is for the new grad to provide a little more context on your clinicals. instead of saying, you know, I did my clinical in med surg at Hartford Hospital, and I did pediatrics at NYU and obstetrics at Yale New Haven, a little bit more about the unit. At Hartford, it may have been on an orthopedic unit, or it could be a cardiac step-down unit with telemetry or something like that. It just gives a little more context, and people then will have a better sense of where you're coming from. Any kind of healthcare experience is always helpful, but it's not an absolute requirement. I had a manager who used to say, give me a bartender, a waitress, or a waiter who has been on their feet and dealing with people who are not always that happy with you. That kind of experience in dealing with people is very valuable. So however you can get that is something that would be good to note on your information that you submit. What do you other guys think?
I agree. But I don't want that to be, you know, drag out your resume either. Like,
Of course.
right? Yeah. So like, I want to know those things, but like, I don't need to have 6 bullet points about how you were a bartender. So I just,
Yeah.
that's
Yeah, people can put that in, you know, other non-healthcare related experience, you know, bartender, whatever. And the other thing, when I say about adding this context, I don't need to have in there that you did vital signs and you did INO and you did sterile dressing changes. I don't need that. Don't use your space in a resume that way, because that's inherent in what you've done as a student, and we know that. So give us the other things that really define more of what your experience has been that we don't know about.
Agreed. And, you know, again, I think it's certainly circumstantial, right? Depending on the departments, the hiring managers, but, you know, we're not looking for 3 to 4 pages. I usually tell folks to add the, you know, sounds ridiculous, but kind of like the heavy hitters, right? What allowed you to stand out? What were things that you know, made it kind of a differentiator from your clinical rotations to both others, right? You know, that could be different for everybody, of course. But again, as Ann said, you know, clinical rotations are very similar for most. So, you know, don't be as repetitive. We don't need to hear about, you know, cleaning and everything like that. Try to include what's going to allow you to stand out. And from there, obviously, again, circumstantial, but you'll know once you experience that opportunity.
Mm-hmm.
Thank you for that. So this is an easy, oh, sorry, Cicely, go ahead.
I have one more question that just
No, go.
popped in the chat box.
Please,
But I want to be mindful of time. Can I ask it?
please.
So Kelly is asking, if we apply to an organization as a CNA or an aide and did not get the job, will that affect the RN application process?
No, not for us.
No, I think that's obviously on a contingency, right? Failed background checks is an entirely different situation. Of course, you know, with Hartford Healthcare, we're implementing a new Fair Chance initiative. We're trying to be a little bit more lenient with that. But, you know, if you applied for a CNA back in 2018 and you didn't get the job, but you're trying to become a nurse now and, you know, pass your NCLEX, it's not at all going to hinder you in that situation unless, you know, it was something in a legal matter, right?
Thank you.
Thank you. So I want to allow just a minute or so more for Tyler, Caroline, and Ann to shed some words of wisdom, perhaps something that we didn't get to discuss that you really feel that these participants should know as they prepare to start applying for opportunities, or if you wanted just to take the time to plug your organization once more. I just want to make sure we wrap up and allow you guys to have that opportunity. So Caroline, do you want to start? Sorry, no pressure.
Sure. So I'm gonna have a session afterwards. So I think it's an open session, so feel free if anyone wants to join. We can chat more there. I think this was a great forum. I wish we had more time because there's so much other tricks of the trade that I'm sure the 3 of us could share with you. But, you know, look at our website. I think that's honestly the easiest way to know if we're hiring. and continue to network, continue to come to these forums. So critical. You don't know how many people I've hired from just interactions at job fairs. So continue what you're doing. I'm so happy and I wish you guys the best.
Yeah.
Anne, you want to go next?
Sure. One of the things I would suggest is for people to seriously think about where you want to start your career. And it could be the organization, but also, you know, a particular specialty. Think it through and come up with a game plan for yourself of what happens if you're not going to get that, how else you can get there. So again, you know, not everybody's going to be getting into the ICU right out. So what other ways can you get in there? What are they looking for? Someone who already has experience. Well, cardiac and telemetry is a great entree in. But think it through, but keep your options open and I am only going to be working in labor and delivery. That's it. That's all I want to do. If you know that's what your passion is, fine, but keep options open and don't automatically say, oh no, I wouldn't want to do that at all.
That was wonderful advice. Thank you. Tyler?
Agreed, Ann. Yeah. And I think it's important to just say, you know, obviously everybody keep your head up, right? We're going through a global pandemic right now. We're communicating via Zoom, right? It's trying times, especially in the nursing community. You know, it's important to address that too. You know, as new grads, you just got to constantly stay positive, right? You may not get the first opportunity that you interview for, and you may not get the second one, but obviously having a positive attitude going into this, you know, keeping your head high and just understanding that, you know, there's challenges. You're entering into a field that is probably one of the, if not the most stressful, occupation within the country and in the world right now. And, you know, it's good to recognize that it's an incredibly important job and that you're doing a great thing here. So, you know, again, keep your head high and keep getting after it because good opportunities are going to come.
Motivated. Thank you so much. I appreciate all the wisdom that you've shared today. For those participants that are transitioning over to Handshake now, please, Cicely's email's in the chat box if you do need any assistance at all. But in addition, I want to give a moment to allow Dr. G to say anything else she'd like to add before we dismiss.
No, I just want to again express my gratitude to all the students who are, you know, here. I think in our classes, a few students are like, you know, why are we doing this early? And it's never too early to find out when organizations accept applications, and especially in this crazy COVID times, it is so crucial because there are different windows when different organizations, you know, are receiving those influx of applications and resumes. I want to thank all the recruiters because some of the items that you said, we say, and I don't know, and I'm being transparent, you know, of sometimes the students believe what we're saying, but many of us were ex-nurse managers and or worked in healthcare. So it is lovely when you guys reiterate what we sort of preach in the classroom. So I do thank you for that. And again, we just can't thank you enough because we know that you're going to be hiring a lot of our students and it's exciting. I agree with Tyler. We got to keep a positive attitude, hope, resiliency, and to all of you students, you're going to be telling stories that you were hired in a pandemic. So it's, I mean, it is what it is, and we can't embrace the negative. We got to embrace the positive and hope. And I thank everybody.
Thank you so much. And can we give our esteemed panelists a virtual round of applause, please? I love it. Thank you.
Thank you so much. Thank you.
Oh yes,
for the
Cicely, go ahead.
opportunity.
I just want to also thank everyone for their time today, and know to all the students, know that the Career Center is still open. Even though we're not accepting students physically in person, we are running a whole host of virtual events to help you mock interview, resume write, pick our brains in any way, shape, or form you want. Use us as a resource both now as a student and then also when you become an alumni. We've been seeing amongst this global pandemic, we have been seeing extremely high hiring rates in the healthcare service area. So just know it's not like, oh my gosh, no one's hiring right now, because we're seeing amazing numbers right now. So
Thank you. And be sure to connect with Caroline, Tyler, and Ann on LinkedIn to start your process of starting to job search. I wish you all well. Thank you once again, and good luck at the career fair. Bye, everybody.